And have you ever been told that your MRI shows a rotator cuff tear, arthritis, or a labral tear, and you immediately wondered, does this mean I need surgery? If you are over 50 and dealing with shoulder pain, that's one of the most common fears that we actually hear. The good news is that the MRI finding does not automatically mean that you have to have surgery as your next step. Today we're going to talk about when shoulder surgery may be necessary and when it may not be, and why your MRI doesn't actually tell you the whole story.
Let's talk about the MRI surprise. You get MRIs that they take a picture of a part of your body and you expect that it tells you the whole picture. But what research has shown is that MRIs may show that you have degeneration of your rotator cuff. You may have partial thickness or full thickness tears of one or more of the tendons or the biceps tendon. You may have joint surface wearing. You may have narrowing of the joint. You may have arthritis. You might have tears of the labrum. There are a lot of things that can show up that don't mean that you are going to need surgery. We look at how you function rather than the MRI. So we like to say we treat the person, not the MRI.
So why does imaging not always equal surgery? And imagine if we took an MRI of every single adult over the age of, say, 40 years old. And you're still going to find wear and tear changes in everyone. Just like when we age, that wrinkles appear on the outside of our body, the tissues change on the inside of our body too. The more important question is, how are you functioning? Can you reach up overhead? Can you put that glass away in the cabinet? Can you reach behind your back? Can you wash your back? Can you get dressed? Can you lift your grandchildren? Those sorts of functional activities, even just exercise sometimes is uncomfortable for people. And those are the answers that we are looking for first.
When conservative treatment should come first? Most of the time, truly. But there are a few instances where it's not. When we're evaluating somebody and they tell us that they've fallen, so they've had a traumatic tear. They can't raise their arm because it hurts so badly. They have severe instability, which could be chronic or could be the result of a fall. They have progressive weakness, which might indicate something in the cervical spine. Or they may have fractures. All of those things we have to look at, and those may indicate surgery rather than conservative treatment.
So why should conservative treatment come first? And for a lot of conditions, that's what actually should happen, should be the first option. And so what you need to be looking at are things that strengthening the weak muscles, addressing posture, improving neck and upper back mobility.
You've been drinking today?
Reducing irritation and inflammation, and improving your shoulder mobility. Many people experience significant improvement without surgery once the true source of the symptoms is identified. And we're often able to help people avoid surgery by addressing that underlying cause of their shoulder pain rather than simply focusing on the area that hurts. And we've got numerous stories of people that we've been able to help that have been able to avoid surgery.
The neck and shoulder connection also has to be considered because the neck supplies the shoulder with all of its nervous supply. But beyond the nerves, you have the mechanical connections of a lot of the muscles of the shoulder blade attaching to either the neck or the thoracic spine. So we have to look at all of this. And the better question to ask is, instead of asking, do I need surgery, have I fully explored the non-surgical options? I guess it's starting to ring. And for many active adults, the answer is no. So you deserve to know all of this before you even consider surgery.
So is shoulder surgery really necessary? Often it's not. You deserve to be able to find out the right answer for you. You deserve the ability to be able to seek conservative treatment options and see if that works before you actually end up having surgery. And sometimes it is necessary, but not all of the time. If you are struggling with any shoulder discomfort, comment shoulder below this video, and cheers.
Cheers.
Thanks for watching. Dr. Mike and Dr. Tiffany Kriz with Kriz Physical Therapy. Talk to you soon.